Hi, I'm Dr. Pecoraro. I'm a chiropractor in Westfield, New Jersey, and today I'm here with my daughter Carolyn, and I wanted to ask her a couple of questions so that you have a little better idea of how to use a chiropractor in your everyday life. So, Carolyn, how old are you now?
24.
24, and this is your baby?
This is my baby, Leo.
Okay, you're
He's
married?
4 months.
Okay, and how long have you been married?
About 2 years.
And how long have you been out of college?
About 2.5 years.
Okay. And Carolyn's basically been my patient for her entire life, is that right?
Yes.
Okay. And did you like having me as your chiropractor?
Yes.
Okay. And what kinds of things did you use the chiropractor for? Would you still use the chiropractor for now that you're not living at home anymore?
I don't know, I guess when I have back and neck problems, and usually when I sleep in the wrong way or am on the computer for a long time, usually bothers my neck and my back, and then I usually need to come.
Okay, so mostly for back and neck things.
Right.
Are there ever times when you use the chiropractor for other things?
Sometimes.
Like what kind of other things? Can you name a couple?
Like, I have asthma, so for my asthma, but I still go to the allergist for that also.
Okay, so as far as you know, chiropractic care does something for asthma, but not necessarily everything for it.
Right, it usually helps, but it's usually not. I still usually need medicine.
Okay, and that varies from patient to patient, by the way. That I would say in my practice, maybe a third of the patients get cured completely of asthma. Another third of them don't get any change, and the other third have varying degrees, like Carolyn. And what about things like headaches?
Yeah, headaches. Like when I was pregnant, I had a lot of hip pain and back pain. Those things also helped with the chiropractor.
So I adjusted you when you were pregnant also?
Yes.
How did we do that? Because you couldn't really lay on your stomach, could you?
Yeah, I laid in a way so just like my upper back was on the adjusting table and let my stomach kind of hang off the table, or on my side, or sitting up.
What about on your hands and knees sometimes, right?
Yeah, my hands and knees sometimes too.
Okay, good. And has anybody else in your family ever come to the chiropractor?
Yeah, my husband, Paul, and also Leo once.
Okay, and this is Leo.
Yes.
And how about your husband's family? Has any of them ever come to the chiropractor?
Yeah, a lot of them go to the chiropractor.
Now, they were using the chiropractor even before you met me, some of them, right?
Yeah, I think they've been going to chiropractor for a while, and also for, pregnancy. A lot of, I know that they've had a lot of like hip and back problems during their pregnancy that the chiropractor helped them with a lot.
Now, did you ever use the chiropractor for, say, the normal, say, childhood and adult diseases that most people wouldn't think of? Like, if you had a fever, would you think it would help to get adjusted?
I think it might help a little bit, but if it was a serious enough condition, I'd probably still go to the regular doctor to get some medicine if I thought it was severe enough that I needed that. But going to the chiropractor would still probably help, because it helps with like headaches and things like that, which usually come along with colds and fevers.
So you use both?
Right.
Okay. And can you see, what about things like something, are there things that could happen to you that you wouldn't even think of a chiropractor, like a broken leg?
Right, something like that I wouldn't go to the chiropractor for.
Or if you thought maybe you had appendicitis or something like that, would you probably go to the chiropractor?
Probably not.
But most things that have to do with your back and neck and
general health, yeah,
physical.
Probably would go to the chiropractor.
Okay, so you've used the chiropractor for both types of things over the course of your life, and you probably continue to use it?
Yes.
Okay, and what about if your father's not around anymore someday? Would you probably still use the chiropractors?
Yes, I would have to find a new one.
Okay. Okay, well, thank you, Carolyn. Thank you, Leo. That's all we wanted to know today. And I hope this information helps you in your everyday life, and we'll try to bring you more information at another time.